Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, my name is Alex Chu. I'm counsel in the K&L Gates Research Triangle Park office. I'm a member of the Healthcare and FDA Practice Group, where I help clients address healthcare regulatory issues and negotiate payer, supplier, and vendor contracts.
Hello, my name is Ashley Davis. I am a healthcare associate in the Research Triangle Park office of K&L Gates. My practice focuses on provider reimbursement disputes and healthcare regulatory matters. Today, we will be discussing the end of the continuous Medicaid enrollment per the 2023 Consolidated Appropriations Act and potential impacts to healthcare providers.
For our listeners who may be unfamiliar, in March of 2020, the Families First Coronavirus Response Act was enacted.
The Families First Coronavirus Response Act included a provision that allowed states to receive a temporary federal medical assistance percentage, or FMAP, increase in federal funding if participating states agreed to allow Medicaid beneficiaries to remain continuously enrolled in the participating states' Medicaid program for the duration of the public health emergency. Medicaid enrollment increased by an estimated 20 million people during the 3 years, due in part to continuous enrollment requirement.
But with the enactment of the 2023 Consolidated Appropriations Act, the Medicaid continuous enrollment condition ended March 31st, 2023. Effective April of 2023, states that had been claiming temporary FMAP, or FMAP, were allowed to begin terminating coverages for individuals no longer eligible for Medicaid, following a redetermination of the individual's eligibility status.
It is within the purview of the states to conduct redeterminations and decide whether current Medicaid beneficiaries remain eligible for their states' respective Medicaid programs now that continuous enrollment requirement has ended.
Each state has its own Medicaid disenrollment process and timeline. We anticipate that approximately 36 states will begin their Medicaid disenrollment process in May and June of this year.
The Department of Health and Human Services estimates that 15 million people will lose health insurance coverage during this de-enrollment process, 8.2 million due to loss of eligibility, and 6.8 million due to administrative training, such as temporary loss of coverage due to changes in income or circumstances.
The industry is taking efforts to educate impacted Medicaid enrollees with options. For example, the American Hospital Association joined Connecting to Coverage Coalition, a diverse group of organizations working to provide trusted information about the Medicaid redetermination process and minimize disruption in coverage. America's Health Insurance Plans, or AHIP, published toolkits in English and in Spanish to help with moving to employer-provided coverage or to marketplace coverage.
Still, with the end of Medicaid continuous enrollment and its potential impacts, there are a number of considerations for health systems to take into account. For some providers, Medicaid disenrollment process creates an opportunity to earn higher reimbursement rates, as some of the estimated 15 million people who will lose health insurance coverage due to the end of the continuous enrollment will attain private health insurance via their employer or the health insurance marketplace, which is usually at a higher reimbursement rate.
However, there are a number of potential negative consequences that could result from the end of continuous enrollment, particularly for healthcare providers and healthcare systems.
For example, those who will lose health insurance coverage during this period and can't or don't obtain private insurance are less likely to obtain routine or primary healthcare services. Some may present at the hospital emergency department for care.
Some patients may qualify for hospital charity care programs, possibly creating economic pressures on such programs. Anecdotally, one of the health systems recently estimated that the end of the continuous enrollment could result in a loss of $70 to $90 million in their revenue.
This is why we are encouraging health systems to be prepared for this change.
To that end, we have some helpful tips that will help health systems navigate these changing tides.
First, we encourage health systems to review their state's guidance on the Medicaid disenrollment process to understand potential impacts to its patient population.
We also encourage health systems to review their financial need policies to estimate any potential impacts to their financial needs programs.
Hospitals may want to verify patients' insurance coverage has not changed recently when seeing patients.
K&L Gates has a knowledgeable and experienced healthcare regulatory group that can assist healthcare systems and healthcare providers in navigating the changing regulatory environment.
Thank you for listening.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.